Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department, joins me today. Hello.
Good morning, ma'am.
We are marking a pretty solemn anniversary today in that our first case of a Hamilton County resident contracting the COVID-19 virus happened on this day a year ago. How are we doing number-wise as we broach this anniversary?
It's hard to believe that it's been a year, but we are looking at some pretty significantly low numbers compared to what we've seen. Just briefly glancing at the state's website, we're looking at daily positivity rates around where we were when we were in full lockdown. So that's a pretty significant change for us here in the county. And I think, kudos to everyone for doing what they've needed to do. I know it's not been easy all the time to wear the masks and socially distance and find alternative ways to socialize with friends and family, but I think we're seeing that pay off now.
Well, and probably the most important message at this point too is to stay vigilant, right? Let's not take our foot off the gas.
Yeah, that's right. The CDC came out with new guidance for folks that are fully vaccinated. They can meet indoors in small groups without masks, but they highly recommend that you keep it to family members and one external family. So they still want you to keep that social bubble small. And, if you're going beyond that, they still recommend wearing your mask as well, or, and keeping it outside as much as possible.
We had a change in status on the state health department's map late Friday afternoon. They took us from a yellow advisory back down to blue. Do you want to talk about what happened there?
Sure. So we were trending into the blue category, and we're getting ready to have our advisory level lower to blue, which opens up capacity for our restaurants, our businesses, and our events much, much higher, which is perfect timing for St. Patrick's Day this week and the beginning of March Madness and some of these other things that are coming up. And then on Saturday, the 5th, that's Friday the 5th, they put in over 200 cases were added to our list, which when they do their factoring in a black and white world, that it raised our number of cases per 100,000.
And some of these cases, they dated way back, like to January, right?
Right. So we asked the state for some clarification, and it was a lab that had not been reporting in a timely manner that the state had already known about and was working with. So we asked the state to use some common sense methodology here, and huge thanks to our elected officials here in the county and those that work downtown, as well as the folks we work with at the state, for recognizing that this was not a black and white numbers issue, that this, the data dump that was put in was adversely affecting how we perceive the health of the county, and we were able to get that fixed. And, like we said, St. Patrick's Day is Wednesday, March Madness is starting. This is going to be a critical time for some of these businesses to be able to get themselves back on track. We want to make sure they have every opportunity to do so in a safe fashion as well.
The other big headline today is that teachers can start getting vaccinated. What do we know about that? How do they get themselves registered?
So teachers have been able to get vaccinated since last week through Kroger, Meijer, and Walmart. Starting today, they can use the ourshot.in.gov website, which will allow them to register at our site, at the 3 hospitals in the county, as well as the Fishers Health Department as well. So that opens up a lot more options for them to get in and get their appointments as well.
Do they have to bring something specific with them to indicate that they are a teacher or educator or a support staff member?
It does not hurt to bring your school ID, but I don't think that anybody that is being asked for at that time. You need to provide proof of your status when you sign up. And that's not just teachers, that's the support staff as well. That's bus drivers, janitors, the administrators, substitute teachers. So basically anybody in the pre-K, daycare, all the way up through K through 12 system are eligible to get vaccinated effective today through rshot.in.gov.
So on Wednesday, we learned too that the Indiana Department of Health is actually also including a whole new list of comorbidities that are now available for vaccination. What do we know about those? I know it's a long list. Is there any place we can find that?
Yeah, the first thing I would suggest is that folks go to coronavirus.in.gov/vaccine. And on the page, there's a link to those that are eligible. And it is quite a lengthy list and growing. So I'd highly recommend that if you have any questions, you take a look at that and educate yourself as to what those are. And the big thing to note is if you or a family member qualifies under those comorbidities, that you receive a special link through your care provider. So I don't know, some of them, I don't know if it would be your primary care provider, or in the case of, certain cancers, you may need to go to your oncologist specifically as opposed to your primary care to get that link to get registered.
And finally, starting today, we're going to start delivering vaccines to people who are homebound. Tell us how that is working.
Sure. So it's taken us a little while to get our program up and running. We wanted to make sure that we absolutely had as many of the kinks worked out as we could. Right now, we have about 50 folks who have signed up through FSSA's website. And we've gone through, we've called them, we've scheduled them. We've already scheduled their second appointments. And we will be working with our EMS providers today to get those vaccines out to the folks that are unable to come out and see us at our vaccination clinic.
And before I let you go, I would be remiss not to ask you about St. Patrick's Day and March Madness, tips for those folks who are going out to celebrate those out in public.
Yeah, again, outdoors is always best. Wearing your mask is always best, and socially distancing, again, with those that are outside your social circle is always the recommended course of action, along with frequent hand washing as well. We want to see everyone have a good time. Everyone enjoy the nice weather that's coming. It's been here. It's coming back after today, hopefully. And, but we want you to do it safely. And, you and I were talking before we started about spring break. That's one of those things where, we've seen after every holiday or every school break of any kind, we have seen a spike in cases afterwards. And we would highly encourage you, if you are traveling, to make sure you're wearing your masks and you're socially distancing, regardless of what the protocols are in that state. Mm-hmm. Highly encourage you, because, you're bringing back whatever you pick up down there. And we'd ask that you be respectful of everyone back here while you're having your good time as well. So.
Fantastic. Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department. We'll check in with you again next week. Thank you.
Thank you, ma'am.